2, 3.
Hello guys, so today I'm here with Maria, and we're going to be going over the aortofemoral bypass surgery. So the definition of the surgery is as follows. So aortofemoral bypass surgery is used to bypass deceased large blood vessels in the abdomen and groin. To bypass the blocked blood vessel, blood is going to be redirected through a graft made of synthetic material, which is then sewn to the existing artery, and this allows for blood flow to the leg. So some examples of when this would be necessary are arterial obstructions due to atherosclerosis, occurring most frequently in the aortoiliac segment of the arterial system, causing claudication. Results of arterial bypass in this region are good because of its high flow rate and large diameter vessels. So the position that the patient is going to be in is supine, and postoperative bleeding from the anastomosis site may need to be repaired with a single arm Crowley patch suture. It's a safety precaution we have to take. The prep boundaries are from mid-chest to toes on both legs, bilaterally as far as possible, and the entire leg. So some examples of the drape that are used to drape the patient are as follows and in this order. So the genitalia is going to be covered with a folded towel. 4 towels are going to square off the abdomen and inguinal region. Adhesive inside drape is placed. A laparotomy drape and bandage scissors are then used to extend fenestration over the femoral arteries. So the anatomy that's going to be involved in this procedure is the profunda femoris, inguinal ligament, deep circumflex iliac vein, abdomen and colon, aorta, vena cava, and the femoral artery. So to briefly describe the procedure is Maria here. She will go over that.
Okay. Incisions are made in each groin lateral to the vascular axis with dissection of the profunda femoris down to the first perforating branch or beyond. The inguinal ligament is partially excised and the deep circumflex iliac vein divided. The abdomen is open and the transverse colon and omentum are reflected superiorly. The small bowel is displaced and covered with warm, moist packs. The posterior peritoneum is incised and extended toward the aortic bifurcation. Portion of the aorta is isolated and cleared, and the left renal vein is mobilized. The retroperitoneal tunnel is developed. Blood is drawn from the vena cava and knitted. Bacon graft is selected and pre-clotted. The patient is heparinized systemically. A large vascular clamp is applied to the aorta. A section of the aorta is excised and the distal aortic stump is oversewn. The proximal stump for the aorta is prepared for anastomosis, and the bacon graft is sewn to the aorta and in an end-to-end fashion. The vascular clamp is applied to the common femoral artery. An incision is made into the common femoral artery, and the graft is cut to correct the length and is beveled. The graft limb is anastomosed to the femoral artery before the completion of the anastomosis. The proximal and distal clamps are released to flush the graft, and the femoral structure line is flushed with heparinized saline. The structure line is completed for the right side, and the same process is repeated for the left. The posterior peritoneum and pre-aortic fascia are closed over the graft, and the abdomen and groin incisions are closed in layers, and a glue dressing is placed for each incision.
3 examples of equipment and supplies that may be needed is a major laparotomy set with large abdominal retractors and soft tissue instruments, a peripheral vascular instrument set, heparinized saline solution, and risk factors that are involved in the procedure is surgical site infection, which is failure of graft, rejection of graft material. Describe the drape. Our question is the draping that is used in this procedure.
Thank you guys.